We are joined by Dr. Gadpaile of the Manohar Lohia hospitals to talk about dengue, chikungunya and the outbreak of vector-borne diseases. Welcome, sir.
Thank you very much. Thank you very much.
Last year, Delhi had a massive outbreak of vector-borne diseases. The same thing can be seen even this year. Why is this happening? This is becoming a recurring event now.
Yes, your view is correct because for containment of any vector-borne diseases, we require a three-pronged therapy. One, the individual participation. Second, community participation. And third is government intervention. We, as a people of Delhi, living to the government only. We do not take activity at our own side. So first activity should be taken at our own side. Everybody knows that dengue is spreaded by the mosquito bite, that is called Aedes aegypti, and which is a regular biter in the daytime only. So how it happens? Because there is a stagnation of water. Stagnation of water in the flower plot, stagnation in the pond, stagnation of water in nearby your area, and due to rainy season there may be accumulation of water somewhere here and there. So it is our duty as an individual to clean that water, because as you know, every 8 days, minimum 8 days are required to produce a larva. So if a person cleans his water around his nearby house, automatically the production of the Aedes aegypti will get vanished. So we are lacking on the individual level also.
So is it only negligence from the individual side, because there has been number of deaths as well, and the same thing is repeating again? Don't you think that some kind of cooperation is necessary from the government side?
That I am coming to you. Now the community level. Community participation is must. No program will get success or will be reached to its target without community involvement. The government and community should work together. Government gives messages, community should follow up. Number of preventive steps government has given to the public, that you should not allow water to stagnate, pitch the ditch, go slowly, wear a long sleeves, then you use a mosquito anti-repellent, do the regular fogging, call the MCDs or NDMC people and a corporation people, get your area clean. So these are the community participation, where government, the community must involve government. Government parts comes last. First 2 steps we have to take first, and then government will come later on. Now government part is that government should provide adequate measures for prevention, which I already narrated, then adequate measures for treatment also, and adequate measures for the information, education and communication, that is called IEC. So government stands here. They should provide adequate infrastructure like a medical management. They should provide earmark some beds. Then they should keep adequate stock of the medicine. They should deploy more doctors. They should make some sort of isolated services for these patients. There, the involvement of government comes.
Most of the cases that we see are being suffered by people who are not very well off, who are not wealthy people, basically belonging from slums. So do you think the government has done enough, or the corporations have done enough, if we talk about fogging or fumigation, to control the outbreak?
Yes, the government is taking appropriate measures for it. As you know, the Delhi is a very huge area, and corporation taking care is best. But number of the obstacles are coming, like sanitation part, stagnation of water, no proper drainage. All this will give the breeding areas to the Aedes mosquitoes. So people must participate in this movement. As our Honorable CM also given some sort of thing that we will fight with the dengue. Why? It is one of the motivation towards the people that we must come together, close together, fight with together. Otherwise alone cannot fight. It is impossible. As you know that dengue is a self-limiting disorder, and there are categories of the dengue, and according to the categories, doctors should acknowledge the red flag symptoms. Where doctor skill is important. Person comes, he is not been detected properly, he takes away at home. And next 1 or 2 days after, he comes very serious in condition. That is called dengue shock syndrome.
So, if people have to understand that they can be infected by the disease, So what are the first symptoms that people should know about, and as soon as they figure that out, they should go and check up with doctors?
The first symptom is very high grade fever, severe throbbing headache, then severe backache, we can say break-bone fever. And after 1 or 2 days, there are certain rashes on the body. Not initially. Initially, there is no rash. So, every dengue patient will get the rash. It's not true. Every patient will get rash is not true. But if you take the treatment at a proper time, management of the fever by giving antipyretic, especially paracetamols, giving good hydration, rest to the body is very important. Without that, you cannot do anything. Water and hydration is the treatment for dengue. Later on, that is third and fourth stage, if platelets come down, then you can transfuse the platelet. But I don't think the platelet is the immediate requirement for a patient. I will advise to the people of my Delhi and around Delhi or India through your media that they should not get afraid for platelet count, low platelet count. Up to 10,000 platelet count, even there is no symptoms, no any bruise, no any redness, we do not advocate the platelet transfusion. So they should not be very much frustrated for platelet.
So this year only, according to reports and data, 251 cases of dengue, 193 cases of chikungunya and 174 cases of malaria have been reported so far. So don't you think it's a very shocking number?
Not very shocking, I can say. It is a continuous process, and every day we are getting the cases of dengue and chikungunya. In our hospital also we are got 132 cases of dengue and chikungunya, and we are examining. Only confirmed cases I am telling. Otherwise, up till now we have suspected 647 cases.
647 cases of dengue and
chikungunya we are suspected. We are treated as a symptomatically because treatment remains the same. Whether it is a viral fever or any other fever or dengue fever, treatment remains the same. But out of these 647, we have confirmed 134 cases of dengue. Okay. And they are all well. There is no death. They are all discharged.
So apart from fogging and to other things to control the outbreak of disease, hospitals have been asked to increase bed sizes and additional medical supply should be there. So from your end, what have your hospital done to curb this?
Yes, definitely. The Honorable Minister of Health, Sri Nadda ji, has given us instructions. We have reserved ward for the dengue. For male wards, ward number 8 is reserved. For children ward, there is a special ward we have made it. And all type of dengue cases we are admitting there. No any issue. We have sufficient beds. And up till now there is no death from our side.
So talking about other hospitals, if we talk about AIIMS, we just saw that there is an overcrowding. People are forced to sleep outside. So what do you have to say about that? Because they're all government hospitals, right? So if these are the kind of things which will go on happening, how will normal people who don't have enough money, get their treatment?
As you told that AIIMS is autonomous institute from our Ministry of Health and Family Welfare, they can take their own decision, and they are. I think they can manage the dengue cases nicely. But as you know that there is maybe always full of the beds, so they are referring their cases to other hospital also.
Which other hospitals? Are you talking about private hospitals?
Not private, usually they refer to Safdarjung hospital, but people like to go to other hospital because as you know the Safdarjung hospital is very nearby, but that is also very much crowded one.
So apart from vector-borne diseases, can you talk to us about the swine flu as well, because few cases have been reported, how massive it is, and is there anything to panic?
I don't think there is panic in the swine flu because now it is a community-borne disease. It spreads to the air flow, that is droplet infection, and it is a viral infection. H1N1 is another type of influenza, and it can be spreaded from one person to another person. Those person is suffering. The infectivity starts from the day 1 and lasts till the last date of the fever. So it is a gap of 7 days, and it is a self-limiting also. But as I told earlier, in case of dengue also, whenever the person has such type of fever, they should report to the doctor immediately. They are coming very late to the doctor. They are getting treatment somewhere here, there, and not getting a proper treatment. For H1N1, there is a definite treatment. Government has provided the antiviral medicines which is available to the all government hospital. At least in RML hospital, there is no shortage of any type of medicine, no shortage of any ward also, no shortage of any ICU also, no shortage of any PPE kit or N95 mask or triple layer mask. So we can adequately handle the cases of swine flu very well. The person who dies, they are very comorbid. They are not isolatedly having H1N1 infection. They are having diabetes, COPD, asthma, or any other disease they might be suffering. And especially pregnant ladies, they are very vulnerable. So we have to be very careful in this case. Small children are very vulnerable in this case. And nowadays we are providing vaccine also. Those healthcare workers, those who are associated with our hospital and day-to-day handling, we are providing the vaccine also.
Yearly vaccine.
It is yearly vaccine. Now the strain has changed. Michigan strain has come from California to Michigan. Because every year the America tests for the strain, and the strain which is prevalent, that prevalent strain we have to give the vaccine. Otherwise it will be useless.
Are people aware of the vaccine? Do they come and take it every year? What do you think?
They are aware. Especially it is our duty to provide vaccine to our healthcare workers, those who are handling, and the persons who are having comorbid condition. That's why I told you, diabetes, COPD, bronchial asthma, hypertension, CAD, we provide them vaccine.
So normal people come and take the vaccine?
Yes, they are allowed to take and we will provide them.
Okay. And how many cases have been reported so far?
So far we have got 134 cases of swine flu here, but Delhi outsides are around 89 and rest of the things from outside
There
Delhi.
are 4 cases of death in this year.
Yes, that's why I told you. These cases are comorbid condition.
So this is not only
Only isolated.
swine flu. No.
The person who are isolated swine flu, we have survived them.
So apart from vaccination, is there any other way to prevent it?
The oral prevention is there. That is medications we provide to the persons who are nearby or affected in a close vicinity of the diagnosed patient.
So basically, a person affected with swine flu should be kept in an isolated way because
He should not go in crowd. That all advisories we have put on the website of DGHS. It is available. They should not go in crowd. They should not go to market. They should be restricted to one room. They should use mask and they should wash their hand in a proper way.
so far there is nothing to panic about.
I don't think there should be panic.
Okay.
I think it has gone into the community. So very soon India will get the immunity. Very soon it will get immunity.
Thank you so much for joining us.